Hello students, welcome back to Enamel Heroes. So today I am back with another topic and that is inferior alveolar nerve block. So in this video I'll be covering everything that is required for you to know for the Viva point of view. So let's get started. So inferior alveolar nerve block, also known as mandibular nerve block, and there are the certain areas which are anesthetized by inferior alveolar nerve block. Just look into the picture. This yellow color area. So mandibular teeth to the midline, means from central incisors up to the molars, anterior 2/3 of the tongue, soft tissues and the periosteum, and body of the mandible. So these are the areas. Now let's see the landmarks. Mucobuccal fold, anterior border of remnants of mandible, external oblique ridge, retromolar pad, internal oblique ridge, trigomandibular raphe, buccal suckling pad, and trigomandibular space. So this is the mandible, and just in case if examiner gives you mandible along with the syringe or the needle and ask you about a target site, so I think you will be able to tell. This one is the schematic diagram of mandible. See the structure. This structure is lingula. I have made same here also, and this is the mandibular foramen. So here is the mandibular foramen, and this is the injection site. So this is the injection site in the mandible. This is the injection site, okay, just above the mandibular foramen. I think you will be able to tell. Now let's see the subjective signs. Tingling and the numbness of the lower lip. Why? Because mental nerves get anesthetized, and the tongue. Why? Because lingual nerves get anesthetized. So these are the subjective signs. And objective sign is instrumentation. You will do instrumentation with periosteal elevator. Okay. Now let's see certain key points. These key points are very important, and these are very important, and these are frequently asked in Viva. So what will be the approach if you are giving the inferior alveolar nerve block? The approach will always be contralateral, means opposite side of the premolar. Okay. And needle should be parallel to the occlusion plane and at least 6 to 8 mm above the occlusion plane. 6 to 8 mm above the occlusion planes. Okay. Suppose this is a contralateral side, so the needle will be like this. Sorry. Suppose from opposite side, the needle will be like this. Okay, from the opposite premolar region. And they can ask you about the gauge. So we use 25 to 27 gauge needle. Okay, and we deposit. This is the rate, 1 to 1.5, 1.8 ml slowly in 1 minute. This is the rate, 1 to 1.8 ml per minute or 60 seconds, in 60 seconds. And for lingual nerve we deposit only 0.2 ml and we aspirate in 2 planes. If it is negative, then we deposit, but if it is positive, the aspiration is positive, we discard the needle. Okay, and we use different syringe. Okay, now let's see the complications. So the complications of inferior alveolar nerve block are hematoma, trismus, and transient facial nerve palsy. And about these complications I have explained in detail. What is hematoma, its management, separately in different video named local anesthesia. So you can just go and check it out. What is hematoma? Hematoma is the effusion of the blood into the extravascular space if any blood vessel get injured. Trismus is a jaw lock. Transient facial nerve palsy, as the name suggests, it is a weakening of the muscles in the facial region. muscles get weak. About these complications I have explained in detail in a separate video, that is local anesthesia, so you can just go and check it out. So that's it for inferior alveolar nerve block. These are the things that you should know, and these are the only things that you should know. You don't have to study anything else apart from this. Okay, I hope the topic is clear. You are knowing what are the landmarks and what are the areas which are anesthetized by inferior alveolar nerve block. You'll be able to tell the target site in the manual. What are the subjective signs, what are the objective signs, and these key points are very important. Okay, and about the complications, you can go and check it out my video on local anesthesia. Okay, so that's it for this video.